It's a condition no man wants to admit he's suffering from: erectile dysfunction. But according to the National Institutes of Health, an estimated 30 million men in the U.S. are affected by it, and twice as many have reduced sexual function they would like to improve. Its prevalence increases with age.
ED is caused primarily by decreased blood flow, and that happens because the walls of our arteries start to thicken at a fairly young age, as young as age 20 as a matter of fact, and as they thicken it cuts down on the blood flow. The arteries in the penis are tiny, so a little bit of thickening makes a huge difference in erectile function. The most important thing in the diagnosis of ED is the clinical history of the patient and his physical exam. I want to know if he has any diabetes, if he has any cardiovascular problems, has any psychogenic problems. Emotional issues and stress and psychogenic problems are a small part of ED. ED is about 90% physical and 10% psychogenic. I examine and determine if there are any obvious physical problems, and then I do diagnostic tests. Based on these findings, we can determine what the patient's treatment should be.
Most ED treatments work by increasing blood flow to the penis. We're all familiar with the pills that a man can take daily or even as needed, but are they the magic bullet?
Most patients with ED are treated with oral pills at first, but they don't work for everyone. As a matter of fact, they only work in less than 50% of men.
A new treatment for ED is making waves in the medical community: extracorporeal shockwave therapy.
Shockwave therapy is a sound wave treatment that is directed directly at the vessels and the tissues of the penis to produce new blood vessels and improve the blood flow. Sound wave therapy helps men with obvious, severe ED, but it also helps men who just simply want to improve their sexual performance.
The combination of shockwave therapy and PRP, or platelet-rich plasma therapy, is proven to have an enhanced effect on penile rehabilitation and rejuvenation.
When shockwave therapy is applied directly to the penile tissues, it produces new blood vessels. It produces growth factors that causes new blood vessels to form, and PRP also breaks down into growth factors that do all the same thing, produces new blood vessels and new tissues in the erectile tissue. This, in combination with PRP, enhances rehabilitation and rejuvenation.
Boston Medical Group is a global alliance of medical centers sharing research information and treatment methods for male sexual dysfunction. In the U.S., Boston Medical Group is a network of independent physicians that has dedicated its practices to treating ED. For 20 years, the network has treated over 1 million men, many of whom previously had unsuccessful experiences with the popular oral medications for ED.
We believe that it is a man's duty to upkeep his sexual performance to its fullest. And when that ability is compromised for whatever reason, he needs to overcome the procrastination or the embarrassment and seek help. Boston Medical Group is unique because of the Boston Method. And the Boston Method is a proprietary treatment protocol developed and maintained by Boston Medical Group physicians. It allows the physician to accurately diagnose the condition and provide a tailored treatment program that will guarantee the success. Every man is different and unique in his own way, and therefore we develop a treatment plan that is appropriate and best suitable to him.
Vasoactive medications, when properly formulated and applied, can induce a good erectile response reliably and consistently, regardless of sexual stimulation or lack thereof. In expert hands, this treatment works over 98% of the time. Rejuvapulse uses low-intensity sound waves to stimulate the growth of new blood vessels, nerves, and tissues. This revolutionary treatment actually reverses ED without the use of medications or surgery. It works so well that Rejuvapulse is now becoming the first-line therapy for men who have ED or any man who wants sexual enhancement. Platelet-rich plasma, or PRP, is another latest advancement in the field. It releases growth factors that can stimulate repair of damaged blood vessels, promoting natural healing. PRP works well on its own and works synergistically with Rejuvapulse, resulting in even higher success rate.
Rejuvapulse uses low-intensity sound waves. Therefore, it produces no tissue damage and no side effects.
Most men come to us skeptical, even embarrassed, but after they see how well the treatment programs work, they lose all skepticism. I've had wives actually give me a call, and they explain how well the treatment has worked for their husbands, and they thank me for getting their husbands started on that treatment program.
A healthy sex life is important to every relationship. If you're suffering from ED and have been disappointed with results from pills, don't give up just yet. Other treatment options, including vasoactive medications and Rejuvapulse, may be the answer to give you and your partner the lift you need. To learn more about Boston Medical Group or to find a location near you, call 800-280-2100 or visit bostonmedicalgroup.com.